Sawadee Krap. Dr. Addison, Deputy Director General of the Department of Disease Control, Dr. Krisada, Director of the Division of Non-Communicable Diseases in the Department of Disease Control, mayors and representatives from the local administrative authorities, ladies and gentlemen, distinguished guests and fellow advocates for healthy aging and healthy cities. Thank you for giving me the opportunity to say a few words about age-friendly cities and communities. In today's world, we see two trends that interact with each other. On the one hand, an aging population, and on the other hand, a more urbanized way of living. Globally in 2020, 1 billion people were older than 60, a number that will double to 2 billion by 2050. In Thailand, we see a similar pattern. Over the last 50 years, the number of people older than 60 years increased sixfold. And now some 13 million people in Thailand is older than 60. These numbers are projected to continue to rise. And these trends are the results of better investments in health, as well as advancements in technology, and are truly an achievement. But they also require further thinking about what it means for societies, and particularly taking into account the second trend, which is urbanization. How can we collectively ensure that our cities and communities are inclusive, supportive, and conducive to healthy aging? We must switch our goal from adding years to life to adding life to years. In this UN decade of healthy aging, which is from 2021 to 2030, we must focus on ensuring that living longer not only means living more years, but also living in a state of well-being and with vitality. As people grow older, their roles in society change. They are now not longer the breadwinner, the main caretaker, the colleague, the active member of society. And the risk is that older people are considered irrelevant or a burden or passive. This perception, this attitude must be countered. We, all of us, can and must work on age-friendly environments. That means that all people can age well and maintain their physical and mental health. That we create an environment where continued learning and growing is the norm, where older people can fully participate in community life while being given a chance to also give back to their communities. But such environments must also respect older people's independence and let them retain their autonomy and dignity. In other words, an age-friendly environment and age-friendly city is one that promotes health, inclusion, and cohesion across all ages and capacities. So, what does that mean? What can cities and communities do to create an age-friendly environment? Well, there are at least 8 areas where deliberate steps can be taken to foster healthy aging. Housing that is affordable, safe, and accessible. Transport and mobility solutions that are inclusive and efficient, also for those who are less mobile. Parks, sidewalks, and public facilities must be designed with all ages in mind. Older people, just as younger ones, must have access to healthcare, social services, and community programs, and be equal members and participants. We need better communication and information with clear channels of information dissemination that is appropriate for all ages, also the older and those who may be less tech-savvy or have impaired vision or hearing. Opportunities for continued social participation must be created, allowing full engagement and connection with other members of the community. And promotion of respect and social inclusion and combating ageism. Encourage active involvement in society through civil participation and employment opportunities. To move this ahead, local administrative authorities and municipalities can really help to create age-friendly environments. And to help them, WHO has released a practical guide and toolkit for establishing and sustaining such age-friendly environments. And that guide talks about how partners and stakeholders can collaborate across sectors, how leadership and strategic thinking are needed to set clear goals. It talks about the need to allocate human, financial, and institutional resources. And also it talks about the importance of capacity building of professionals and community members. How knowledge and research must be part of any package in order to stay innovative. It mentions the need to assess progress at regular intervals and make adaptations to the program if needed. This framework is already used by cities around the world to create environments that support the well-being and participation of older adults. Examples of cities that have adopted this framework include Tokyo, which has made significant strides in becoming age-friendly by improving transportation infrastructure, creating pedestrian-friendly environments, and enhancing health services tailored to older adults. Toronto was one of the early adopters of the WHO Age-Friendly Cities Initiative. It has focused on improving public transportation, creating accessible outdoor spaces, and promoting community engagement among older adults. Another example is Singapore's Action Plan for Successful Aging, which includes over 70 initiatives across various domains such as healthcare, housing, employment, and lifelong learning. The goal is to create an age-friendly society where older adults can live active and fulfilling lives. These cities are part of the WHO Global Network for Age-Friendly Cities and Communities, which connects cities worldwide to share knowledge and experience in creating environments that cater to the needs of older citizens. Through the Global Network for Age-Friendly Cities and Communities, we aim to inspire change, connect cities and communities, and support the implementation of innovative and evidence-based solutions. This network, as of 2023, has over nearly 1,500 members from more than 61 countries, covering over 300 million people worldwide, demonstrating a global commitment to creating environments where people of all ages can thrive. Actions of local authorities enable Thailand to fulfill multiple global commitments simultaneously, including the UN Decade of Healthy Aging and the Sustainable Development Goals. We understand that the Department of Health has already adopted the WHO guidance and toolkit, and that 126 communities have joined the Age-Friendly Community Network in Thailand. WHO would be very pleased to facilitate and support Thailand's efforts to become an affiliate to the WHO Global Network for Age-Friendly Cities and Communities. So, let us commit to action. Utilize WHO's practical guide and toolkit. Collaborate with other age-friendly advocates and join the network. Learn from others and understand successful national programs worldwide. In closing, may I appreciate the Department of Disease Control for this initiative in bringing together the key stakeholders in one platform to discuss our cooperation in shaping age-friendly communities that would enable older people to be and to do what they value. Age-friendly communities are not just a vision, they are our shared responsibility. Let us create environments where every person, regardless of age, can thrive. Thank you. ขอบคุณครับ